Value management, come join us. So, good morning. We're here to do our value management for the week of 6-7. Remember, we're a week behind, so this is last week's data that we have up here. The number of patients through the unit was 24. The harms event, we did have one fall on the unit for the last week, so we just added that to our board, and that's the plus sign, and that's the one fall. The scheduled orders on time last week was 74%, but I'm going to talk about that. We're going to get a new value on the board, so we'll discuss that when we get down with our PDSAs on that one. The ready to move, we were at 94 minutes. Still not at our 60-minute mark that we were at prior to COVID, but we will get back to it, and this is our average movement on time. So we're doing better than last week, but we still got a little bit work to do on that. And the joy at work, we had 98% joy at work last week, so we're doing well on that. And we're also looking at a new way to do that, which we're going to talk about when we get to our next section of the board. Capacity, we started doing capacity again. I know we had some people doing it yesterday, tracking what we're doing for work, and we did some last night, and we'll do it again today. Remember, we're trying to see the correlation between direct and indirect care. And these are our charts from, it was a while ago because we were supposed to do it during COVID, but we'll do that. Our cost pay for last week, nursing pay was $132,438. The OT for nursing was $1,260, and the PCA cost was $9,805. Now these numbers are a little bit higher, but remember we have a lot of travelers here. We have people taking their PTO, so we're explaining what our costs are for that. So now when we get to the next portion of our board, we talk about our PDSAs. Under quality, we're still doing our cleaning, and that's to prevent our infections. So we're still doing calling if the patient's here for more than 7 days. And also our pressure injury bundle, which we've been checking on that. For throughput, as I said, we're going to switch off from orders on time, which was here, and we're now going to do nursing rounding. So PDSA is, will nursing attending the neuro rounds improve our throughput? And we're saying that it will, because it's going to improve the communications. Therefore, everyone's aware of what's going on. The test will be done in a timely manner, and the families will be happier, and it's going to just improve our overall care of the patients. So this is our new PDSA. The neuro team is involved in that. So how it's going to be done is what we're going to try starting this week. When the PAs are rounding, do you want to talk about it? What you're going to do? Dr. Patel, I know you're recording.
Yeah. So it's going to be, okay, thank you.
So, it's a joint effort.
Yeah, so I think it's going to be there's going to be several stages to this, but I think first we have a committee of nurses, I believe, for the handoff template or whatever. It's going to be, I think it's Carolyn, Aaron, right? Kimberly, and Jane. So it's a template I've used in another hospital, nurses use in another hospital I was at, so, but you guys can, edit it, adapt it to what are our function for our patients. And so that we'll start there. And then at the same time, we're also going to kind of get some baseline numbers on just how the percentage of time or percentage of nurses are present on rounds, and then just something to keep track of. And I think the eventual goal basically is to make sure everyone, or to gain knowledge of how many people are part of the team, but mostly we're studying nurses here because that's the whole, from the value standpoint. But so I want to make sure everybody's understanding the goals and seeing what the goals of the care are, goals of care are for that day. So does everyone understand the goals? So we're obviously hoping that'll increase participation, you know, us with the patients, with the families, all the way around. Just so does that make sense? So we'll see.
So
Thank you.
that's our project that we're going to be starting to work on now. So like I said, we only have our first PDSA, but as a PDSA, as we all know, it's constantly changing. So we'll start this week small and we'll add to it every week. I told you we started doing the capacity again, so hopefully by next week we'll have some new charts to see what we're doing with that. With the cost, we're still doing some saved air taps. It looks like last week we only have 2 air taps on the board that we saved. And remember, they're $100 each, but we have to get back in the habit of that again. But we will pick it up. We're working on getting the drug costs because we were doing great with the Tylenol, saving the Tylenols. So we're working on getting the report from the pharmacy on what the costs are, and Deirdre's gonna be working on that for us. With people, we still have our what matters most, which we have to, again, like I said, we weren't having any visitors for a while, but now that we're starting, we have to start getting what matters most to our patients. And also, that's including our joy at work for our nurses. We have a project going on with that. Also, we have Sean.
He's off today.
Who's else on it?
Me.
Joseph. Oh, I thought they said Tony. So a few of our nurses are working it. We were looking at different ways to collect joy, but right now Dr. Patel is involved in this as well. We're trying to make an app so it might be easier for us to keep track of how the joy at work goes. And the app goes a little bit more in detail than what we were doing with the beads, just good or bad. This way with the app, we'll be able to say why it was a good day or why it was a bad day and what we could improve upon. So
We're
that's
gonna try the QR code first.
We're going to try a QR code first to see how that works. So right now this is a work in progress, and hopefully we'll have some numbers to support that right now, and we'll have the reasons on what's going on. And that's all I have right now for our value management board. Does anyone have any questions, input, suggestions?
I'm a traveler, but at my last hospital, I tried so hard to get like nurse presence at MDR. And so I actually have like a whole lit review on it, if that'd be helpful to you guys.
We'd love it.
Yes.
Thank you. We're
Yeah.
always looking for evidence-based practice, so
Yeah.
thank you. If you can share that
Sure.
with us, it would be excellent.
Yeah,
I look forward to it.
Yeah, one thing we found was that like nurses, we found that there were some barriers to us being able to be present, and so like what we found was helpful was if the procedure nurse was able to cover those rooms while MDR was going on, so you could have uninterrupted MDR, because for us that was the toughest part.
Okay, we'll take a look at that. That would be great.
Thank you.
Very good. Anything else? Any thoughts? Remember, our PDSAs are up here for all to look at and to contribute as we have been doing. So, all right. Thank you, team.
Thank you. Thank you.
Have a terrific Thursday.